Good afternoon, everyone. Actually, I'm not happy today. I came with a sad news, and I'm finding it difficult to comprehend why we should keep having this kind of careless deaths. Actually, it was a preventable death, a very preventable one at that. You know, yesterday evening, a walk-in patient visited our outpatient department, and then the nurse on duty checked her and discovered that her blood pressure was about 85/50. At 85/50, the nurse raised an alarm and said, "Madam, we can't let you go this way. You're pregnant, and then your BP is this. I'm not comfortable letting you go." She alerted the doctor, and they cancelled the woman on an admission. So she could just stay back for an admission, for them to take necessary measures, observe her, and then treat her, such that when she's stabilized and better, she could go home. But the woman said her kids were alone at home, and she couldn't risk leaving them alone. "How about your husband?" the nurse asked, and she said, "He's not back from work." "Does he work outside Lagos?" She said, "No." "Is he too far from your place?" She said, "No, but he might be very busy, so I don't want to disturb him." Okay. That answer was rather not too convincing enough to us. And so the matter was escalated because the woman insisted she wanted to go. And everyone came around trying to persuade her, including me. We had to plead with her to at least put a call through to her husband and inform him about the recent development so he could see how to help out. A neighbor, a friend, or anyone can even stay around with your kids while you take care of your health for just this evening till tomorrow morning, so we are sure that you are fit to go home. Alas, all the counseling fell on deaf ears, and the woman insisted that her kids were too important to her. She wouldn't want to just let anything happen to them. Yes. Eventually, when we couldn't hold her down against her wish, we let her sign the DAMA form. The DAMA form, well, in this case, we don't call it the DAMA because she was not even on admission. She was not even on admission. So we call it, you can call it a LAMA. She left against medical advice. So she signed the form and eventually left. The most important thing is for us to get a documentation that she had actually been cancelled. She had actually been taken through the process of understanding what she was doing. She has been explained to the implications of walking away with such a blood pressure as a pregnant woman and not getting medical attention. She was not on antihypertensive before. She wasn't a known hypertensive patient. She hadn't been managed for hypertension before then. For hypotension, sorry, that is lower BP. The BP was actually lower than normal, not higher. That's hypotension. So it was somehow bewildering to us that she couldn't adhere to those medical advice to at least take care of herself. Well, she left. She eventually signed the form and then she left. That was around 5 p.m. By 8 p.m., the outpatient department nurses had to call her again. Let's even give a follow-up call and find out if she had gone to another hospital or what is now the blood pressure. By the time she picked, she said she wasn't feeling too fine. "Madam, are you coming back to the hospital now so we can still take care of you?" She said she was going to come after her husband returns. "Have you called him to come?" She said yes. She has called him. She's waiting for the husband to come back. Alas, we didn't see her. The shocking news we got this morning was that she died from her sleep. She actually slept and couldn't wake up this morning. So I'm sad. I'm not happy because a lot of women have gone this way. And she didn't die alone. She died with her unborn baby. A new life about to be brought into the world. What happens to the children she left behind? That situation could have been managed better. But in case you feel there's something the nurses and doctors should have done better, please let's know your thoughts at the comment section. It's possible she had things she didn't want to disclose, reasons she must go back home. It's possible she had issues she needed to sort out at home. It's possible she had justifiable reasons why she must leave. Of course, we can't hold you back against your wish. But please let's know at the comment section if there were other ways or better ways we could have helped. Looking at the system of healthcare in Nigeria and what is confronting us. Please let's know your thoughts at the comment section. Thank you.